Nearly $300 million has been earmarked for rural hospitals and health clinics, including for some right here in our neck of the woods. Ethan Purcell joins us live in studio tonight and has more on what this money means for medical professionals right here in West Texas. Good evening, Ethan. What can you share with us?
Good evening, Bert. This comes after Medicaid was slashed by $1 billion in the One Big Beautiful Bill. The $281 million will be used to help bolster rural hospitals and clinics, like Concho County Hospital in Eden, where the hospital administrator says while the exact amount of funding is still up in the air, there are a few top-of-the-list items he'd like to use the money for, like upgrading facilities.
Technology is always something we're going to need to invest in. Equipment is always something we're going to need to invest in small communities like this, because otherwise we don't have the capital to make it happen.
But above that is the need to staff rural hospitals with the same high-quality personnel you might find in a big city, something Pascasio says has been a struggle at CCH and something he's hoping to use his hospital's piece of the funding for.
God bless them. Eden's a beautiful little community. We are the Garden of Eden. We have all these wonderful things going. And amazingly enough, not a lot of folks want to relocate to Eden and practice medicine out here. So helping us fund and bring providers into this community is probably going to be priority number one for this organization.
But there's also the need to meet the rise of uninsured patients in rural areas like Eden and the surrounding area. Pascasio says the poverty rate sits around 20% for adults and continues to rise when you add those under 12.
Funding that will help us ensure that we're able to provide for those folks is going to be really, really critical, because there are a lot of folks out here in Concho County and the surrounding area that need assistance, and we're hopeful to see funding for that.
But above all else, the funding is intended to stabilize rural hospitals across the nation, a welcome initiative with 14 rural hospitals closing over the last decade, and Concho counties and others in Reagan County, Schleicher County, and more at risk of the same.
The state did a study and identified hospitals from a standpoint of we're in good shape to, oh my God, these people are teetering on the edge. I am always optimistic. I am a rural healthcare administrator. I've been doing this for over 30 years. If I weren't optimistic, I'd probably open up a fireworks stand somewhere and change what it is I do for a living. But no, optimism is the name of the game when you're in rural healthcare administration.
According to the Center for Healthcare Quality and Payment Reform, over half of all rural hospitals in Texas are at risk of closing, and 21 are at immediate risk of closing. Live in studio, Ethan Purcell, Fox West Texas. Bert.